Welcome to the Mid-Morning Show. I am your host, Jason Subik. The phone number is 518-843-2500, and this is WCSS 1490 AM radio, 106.9 FM. Let's do our disclaimer. The views and opinions expressed on WCSS are those of the hosts, guests, and callers, and are not necessarily those of this station, its management, the Cranesville Radio Network, or other hosts or advertisers. The content of each program is the sole responsibility of its producer, which in the case of this show is myself. I want to welcome everybody to the Tuesday morning show. Big story, I think, today on the front page of the Daily Gazette. My colleague Zach Mattson wrote the story. This pertains to basically the opioid crisis in the United States and some new information that has come out recently that sort of provides very detailed local information in terms of the amount, the volume, the number of pills that were opioid-based prescriptions that have been sold locally. Interesting stuff. I want to give a little bit of the background on this as we start into this. Basically, there has been kind of a massive lawsuit by a lot of the local governments in New York State as well as around the country against the pharmaceutical manufacturers and distributors. And during the course of that lawsuit, there was some information that came out that was distributed to the plaintiffs in this lawsuit. It was the U.S. Drug Enforcement Agency's database, which tracks all of the sale of opioids in the U.S., all the legal pharmaceutical sales of them. They had that detailed information. They've had it for a long time. That information was not released to the general public. It was information that the federal government had and compiled. And it came out sort of as part of this lawsuit. And basically, the Washington Post was able to sort of piggyback onto the back of this lawsuit, doing a Freedom of Information law request saying that if you're going to release this information to the localities, then you should release it to the general public. And there was a federal judge that agreed. And on the Washington Post's website, they have put this database. And this database has very detailed information about the volume of pills, the opioids being sold locally and across the whole country by county and also by pharmacy and by manufacturer. Very detailed information. So now the interesting thing that came out as Zach Mattson was looking through this database, and Zach's going to call in a few minutes, was that Montgomery County, which joined this lawsuit in May. It basically had, over a 6-year period between 2006 and 2012, 800 prescriptions per 1,000 people. That's 50% higher than the state average. Those are staggering numbers. And we have Sara Boerenko here, the Director of Public Health and Mental Health from Montgomery County. Good morning, Sara.
Good morning, Jason. Thank you so much for having me on today.
Now, when I look at those numbers, I have to say that I think that your lawsuit, you may have a good case, okay, when I look at those numbers. I mean, it's crazy that Montgomery County, just a little rural county, would be 50% higher than the state average in terms of these opioid numbers. 800 prescriptions per 1,000 people. React to that. I mean, it's a lot.
It's a lot, and to be honest with you, Jason, this information, when it was presented to me, I really don't think I've really been able to grasp fully what this means for us being one of the highest in the state. I'm shocked, I'm disappointed, but I also know that the work we are doing to combat this stigma and these numbers is going to well exceed anything that was done between the years 2006 and 2012.
And describe that. I mean, you knew before this. I mean, Montgomery County joined this lawsuit in May. And I know that this information was released actually under a protective order initially, but I don't think that was a while ago, actually. I think that was before you guys were even involved in this. Were you given this database before the Washington Post got it, or no?
No.
Okay.
No.
And so, but this information is still, I mean, how do you react to something like that? I mean, the numbers are far, they're greater. People knew there was a problem, but now you see it.
Right. And I think for me, even if we were not at the highest number, I would still be doing the same work. So for me, I can't go back. I can't go back and say, gee, what happened in 2006 and 2012? There's things that I cannot blame the past on. I have to take a look at what we do today, and we have to move forward and look at the future. And I know that with the work that we have been doing, our numbers of prescriptions are dropping. Our doctors are becoming more aware. We're educating our physicians, and we are educating our community and working with law enforcement and our community to prevent opiate use as well as heroin use. And I want to make sure that we are very clear. One of the things that I think I am constantly battling is people will say people are dying from overdoses. Well, that is very true, but people are also dying from heroin overdoses.
Right.
And I think when we look at the opiate crisis, the opiate crisis is only one facet. We have a heroin crisis.
Right.
We have a benzodiazepine crisis. We have an alcohol crisis.
Right.
We have a substance abuse crisis, because what is going to happen now, Jason, is now that we have the information on opiates and we're eradicating the opiate problem, we know that things like benzodiazepines are on the rise in our area.
Right.
We know that crack cocaine is making a comeback. We know that cocaine is making a comeback. When I started in Montgomery County back in 2004, I remember working with the then sheriff, Mike Amato, and the sheriff's department on meth labs that were in the county. Right. Now those are a thing of the past. So I think when we're looking at the opiate crisis, we have to remember it's an overdose crisis and not necessarily an opiate.
Okay. Let's take a call here. This might be my colleague Zach Matson, perhaps. Let's see if it is. Good morning. You're on the air.
Jason, hi, it's Zach from the Gazette. How you doing?
Hey, good. Zach, thanks for calling in. Really appreciate it. Read your article today. I thought it was excellent. I have in the past referred to you as the master of the spreadsheet. Okay, and that's what this article really is. It's drilling into the data. Zach, tell us about how you got into this and what you found in the numbers.
So last week the Washington Post published a database that they got based on some DEA files that were released in some ongoing lawsuits. And it basically charts every prescription opioid pill, who made it, who distributed it, and what community it went to between 2006 and 2012. So you can look at, they break it down by, for each of those years, how many of these prescription pills went to, each community, each county, and how many that would be per person each year. So when you look at the capital region, Montgomery County, as people know, has struggled with these issues, and they sort of came in with the most over that time period. And when you look at more recent data, there's some data to suggest that that's continued in more recent years.
And when we say the most, we mean like percentage most, right? I mean, it was 800 prescriptions per 1,000 people was one of the stats that you saw.
Right, yeah. When the State Department of Health charts opioid prescription rates for counties, and Montgomery County between 2015 and 2017 had the highest prescription rate for opioids, and that was about 800 prescriptions per 1,000 residents in the county. So that's about, that could be multiple, one person getting multiple prescriptions, but
right.
We're talking about, enough prescriptions filled, to cover 80% of the population.
Right. And we've also got Sara Boerenko here, who you interviewed for your article. Sara, you would say hello to Zach.
Hi, Zach.
Oh, hi, Sara. How are you?
Good to talk to you again.
Yes.
Yeah,
and,
you too.
Yeah. And we had you had like the number of pills per person per year too, right? I mean, it was significant.
Right. Well, that's right. I mean, the Washington Post database does, for those, that time period, 2006 to 2012, does kind of tell you how many pills they were in this database, and that's, over 13 million for Montgomery County.
13 million
over those years.
And the county has, like, how many people who live here approximately, Sara?
We're just under 50,000 at this point.
Amazing number of pills. And it was all legal. I mean, these are all legal prescriptions. Some of them may be fraud. We don't know. But in terms of these drugs being prescribed to people, it was they were deregulated in the early 2000s, and this is kind of where we've ended up as a result of that. And these numbers, they just tell a story, Zach. I mean, they kind of tell you, they give you a trail to exactly where it was happening, and the volume of it.
That's right. And, I mean, I want, the Washington Post sort of pulled out across the country, some counties that really just, blows the mind. And we're talking, like I just said, Montgomery County was at about 38 pills per person per year. There were some counties in the country that were, above 200 pills per person.
That's insane.
So it just kind of shows you how, much these pills were sort of out flowing around communities. And, as Sara knows, that, has had a devastating effect all across the country, as it relates to, addiction and overdose challenges that, are still with us today.
And I think one of the, injustices about this, I think, was that the localities, you didn't have this information, Sara. Okay, even though even though the federal government was compiling this information, they were not sharing it with you until this lawsuit. And then they gave you the numbers, and that was after the fact.
Right, and I think one of the things that we've always been told is, Montgomery County, you're one of the top 16 counties identified as having an opiate problem. You're one of the top 16 counties that's been identified. But the fact that we didn't have these exact numbers, the fact that, from 2006 to 2012, prescriptions were on the rise and these things were happening, and we were losing people as early as 2006, 2012 to overdoses via opiates. And then it caused a trickle-down effect or a trickle-up effect, depending on how you look at it. And the fact that we didn't have those hard numbers and we didn't have the data, it's concerning to me. It's very difficult to fight a public health issue or a substance abuse issue or, in another field, a crime issue if we don't know the depth and the breadth of what we're looking at. And so the fact that the Washington Post had to publish these numbers in order to get it out into the public so that officials could actually get a hold of these numbers and see what we are dealing with, it is a big concern for me. And it brings a different light to the topic other than just being identified as being in the top 16 counties in the state.
Right. And the argument that was always given, by the way, by the private pharmaceutical companies was we don't want to give up this information because it would give a competitive disadvantage to another company. Right. If they could see how many pills we were selling here in Little Montgomery County, maybe they would come in and sell it or undercut us. And when you're dealing with a public health crisis, to me that becomes very egregious. That those were the interests that were being protected and promoted by the federal government until this lawsuit by the localities, which Montgomery County joined, Fulton County joined, the city of Amsterdam has joined, because they're dealing with the real issue. And it's good that this information has finally come out.
Exactly, and I think, Jason, for me, when people hear lawsuit, they automatically hear money. And I have always said that money is not going to fix the problem because it's over. The people who have died, money is not going to bring them back. So the lawsuit is wonderful in bringing light to what is happening and prevention, but it's not going to bring people back. It's going to give us the ability, though, to go forward and look at the way we are able to engage in treatment programs, the way we are able to engage in educational programs, the way we're able to work with law enforcement and our healthcare providers in order to do business differently.
Yeah. Zach, I really appreciate you calling in. Do you have any other information for us?
No, I mean, I was also looked at, the State Department of Health data that does show sort of, overdose deaths, and just to give some numbers to people, to what Sara's talking about here, however life matters. In 2018, there were 8 opioid overdose deaths in Montgomery County, and in 2017 there were 7. So, that's the kind of challenge that we're dealing with here.
Yeah. Zach, I really appreciate your calling in. Good work on this. I was going to put this on my budget this week. I was telling Sara before the show, okay, I was ready to write about it, but early bird gets the worm. I really appreciate the work that you did on this. So thanks a lot.
Yeah, I appreciate that. Yep.
Thank
thanks
you,
a lot.
Zach.
Yep. All right.
Yep. Thanks, Sara.
Yep.
Bye.
Bye.
Okay. All right, so that's Zach Mattson from the Daily Gazette. I encourage people to check this article out. I also encourage people to go to the Washington Post's website and to basically they put this database online. It's a little widget that's embedded in one of their stories, and you can just plug in your county or any county that you're interested in, and you can find out very detailed information. You can find out the manufacturer of these drugs. You can find out the pharmaceutical companies that were selling them. You can find out the pharmacies that were selling them on the local level, the top ones. We were talking before the show in Montgomery County, the top. Heather, do we have those numbers? Yeah. So Heather actually has the top pharmacies that were selling these opioids.
Yep. So it was actually Rite Aid of Amsterdam that received the highest amount of prescriptions.
And that it may be two Rite Aids combined. We were talking before because they're very close together, and it's one corporation, so they may have put them together. But what was the number? It was over 1 million, right?
So yeah, the number between 2006 and 2012 was 13,252,780.
That's the number of pills.
Right, and that's about 38 pills per person in Montgomery County.
Yeah, and I remember from looking at the stats, the Rite Aid was well over 1 million. And they were the number one. And Eckerd was high, too, on the list. And these are the big corporations that were selling these.
I think we have to remember, too, Jason, back in that time period from 2006 to 2012, Rite Aid actually bought out Eckerd. So I would just caution people when we're looking at that number. I know that the Eckerd on Route 30, that's right by the Aldi's, that was bought out by Rite Aid. So I would be interested to see the differentiation between the Eckerd Corporation and the Rite Aid Corporation at the time of the buyout.
That's a good point. Who's who and what's what? Those are good questions that I don't have the answers to, but that is a good job, Sarah, pointing that out. The phone number again is 518-843-2500. And we also had the national number, too, that was sold, right? I mean, it had grown from like 8 billion pills to what?
Yeah, so it went from 8.4 billion in 2006 to 12.6 billion in 2012.
Dramatic increase. I mean, and the whole purpose of this U.S. Drug Enforcement Agency database is to notice suspicious activity. Okay, right? And I mean, that was the point of it. And so nobody noticed a growth of that margin. Let's check the calls here. We've got a call coming in. Good morning. You're on the air.
Yeah, I've got a question. If the time frame we're looking at is 2006 2012, why is it that data is like 7 years stale?
It's a good question. I think this is the most complete information that's available today. Yeah. So.
Yeah, but see, the issue is that controlled substances are highly regulated by the Department of Health, and they keep track of every prescription that's filled. The state should have all that information right up to the date.
Well, I think that this is the information that's been released so far from the Freedom of Information Act.
But like I said,
request,
my question is, why isn't the state a partner with the counties on this, to attack a crisis that's going on?
It's a good question. I'm not now. So you're saying that you think the state has the more up-to-date numbers. The federal government probably
has. Absolutely. And the pharmacies, they might have made a killing off of this, but the pharmacies, all they do is fill prescriptions that are written by physicians and, PAs and practical nurses, family practical nurses. And, what are they supposed to do? They can't deny filling a prescription, can they?
Well,
maybe they can.
Yeah, I think they can, actually. Sarah, does a pharmacy have the ability to deny your prescription if they think it's suspicious?
They do, actually, yes. And I know from experience several pharmacists who have questioned prescriptions. That's why now all of the prescriptions in the state, New York State, are electronic. We no longer have handwritten prescriptions. One of the things...
but we're talking about prescriptions that are fraudulent, that might have been counterfeit. We're not talking about prescriptions that were legitimate, written by a doctor.
Right.
Can they still deny those if they turn out to be a legitimate prescription?
Yes, they can. So just to finish my thought, so back in 2006, 2012, there were a number of cases where pharmacies would actually call the physician. So, for example, there were cases and people who were arrested. If a physician wrote a prescription for 60 pills, it was not uncommon for folks to take and put a 1 or a 2 in front of that 60, and they'd go to the pharmacy, and the pharmacist would look and say, this is strange, I know Dr. So-and-so very well, and I'm wondering why they would give you 160 pills. They would call the physician and they would find out that this person actually fraudulently added a number in front of the number of pills being requested. So through legislation, because these things do not happen overnight, the state came in and said it would be a really good idea to help reduce the number of fraudulent prescriptions that are submitted. So let's move to an electronic system. So now all prescriptions in New York State are done electronically. When that goes to your pharmacy, the pharmacist has the ability to review it, call the physician, question it, and if they don't feel comfortable because of a medication interaction, a drug interaction, they have the ability to deny that. But there has to be a really good reason. They have to be able to call the doctor. There are people who pharmacy hop. They may take some prescriptions to a Rite Aid, for example, and they take other prescriptions and get them called into a CVS. And so the fact that pharmacists have the wherewithal to now be able to call your doctor whose name is on that electronic prescription and find out why they are prescribing those medications and to save the person's life. Because if somebody is taking a medication, they're getting it filled at one pharmacy, getting another prescription filled at another pharmacy, there may be a drug interaction. So it's not only for safety, but it's also for regulation.
Okay, so then if the state is regulating it very highly through electronic prescriptions, then the state has up-to-date, last-minute records of all this stuff. And to me, my point is that if the records that we're talking about in the Washington Post expose or whatever you want to call it are 7-year stale, why can't the state, who is regulating everything up to the pill now, why can't they provide more late-minute records and more relevant records? Because, what is the trend in the last 7 years? Is the county still one of the highest in the state, or has it, tapered off? And where do the physicians fall in this whole scheme? Are there any physicians named in that report who perhaps overprescribed the opioids?
Not in the DEA database that the Washington Post did. They didn't do physicians. They did do pharmacies, but they didn't do physicians. And I don't know whether they have the physician number. I think it's point of sale where they track it.
Well, Jason, and I think too, one of the things that I saw in the Washington Post, I did look at one of the links, and one of the things that the DEA assistant administrator said was that these arrests were pharmacies who were illegally selling prescriptions and pills. So we have to remember that these numbers are based on illegal activity of the pharmacists. So the pharmacists being named in this lawsuit, as per the DEA, according to what the article says, is that these are folks who were fraudulently selling illegal prescriptions.
I think the database, though, was the totality.
The database is the totality.
Right.
But we have to remember that a portion of those pills that were being sold and filled, some of them were illegal prescriptions.
Yeah, right. So those are all factors in this. Now, you're saying you want more recent numbers, caller, and I'd like to have them too.
Well, there are more recent numbers available.
It's just
a question of the state deciding whether or not they should release them.
I would agree that whatever the most up-to-date numbers are, I'd love to get them, and I think that more information is going to come out. This is the stage we're at today. I would like to have better numbers, but
we're talking controlled substances. We're not talking about an antibiotic or something for a cough or cold. We're talking about things which the state has always highly, watched and kept an eye on.
Good point.
To avoid the specific point or the problem which has occurred.
Good point. It's certainly something to look into. Maybe that's the story I'll get to write instead of Zach. Okay, perhaps. Okay. I appreciate the idea, though. Thank you very much. I appreciate it. Thank you. All right. What do we got here? Do we have time for another call? I think we do. Let's try one. Good morning. You're on the air.
Good morning. I haven't heard everything you've said, but what I'm concerned about is statistics for how about cancer patients? Now, they're usually on opioids. Is there a breakdown for those?
Not in this database. It didn't say what they were being prescribed for. We don't know the answer to that. I mean, the numbers are staggering. So, I mean, is there a correlation?
Well, you have, in Montgomery and Fulton County, you have a lot of cancer patients. So I just wondered if they could do a study on that to see how many of those people are actually sick and really need the opioids.
Well, I think when we're looking at the data as a whole, it's not broken down by disease, because if you talk to somebody who has multiple sclerosis, they may say that the opiate is the only thing preventing them from feeling pain because they have multiple sclerosis.
Yeah, that's an interesting concept. I think it should be broken down by diseases, because you can't just say, well, everybody's an opioid addict, because they have certain issues and diseases that need it. So
those two things aren't necessarily mutually exclusive, though. I mean, you could have a very legitimate disease, take the pain pills for that, and then become addicted to the pain pills, so then you have both. Right, Sarah?
Yeah, and that's unfortunately how a lot of this started. Is we have folks who have legitimate illnesses. They go to the doctor for legitimate reasons, and then we know prolonged exposure to opiates or any kind of medication will cause long-term other medical effects, and so the physician tries to taper people off, and people are turning to other substances. So it's really cyclical,
right?
Unfortunately.
And other substances, including heroin. Thank you for the phone call, caller. Appreciate it. We're going to take a commercial break, and then we're going to come back with Sara Boerenko. We're going to talk about this issue. We're going to continue to talk about this issue, but we're also going to talk about sort of what the county is doing to combat it and all of that stuff as well. So we're going to be right back after these commercial messages. And we're back. It's the Mid-Morning Show. I'm your host, Jason Subik. The phone number is 518-843-2500. And you're listening to WCSS 1490 AM radio, 106.9 FM. We're talking about the big story. It's on the front page of the Gazette today, talking about this information that is now available to the public in terms of this database from the U.S. Drug Enforcement Agency, compiled over a 6-year period from 2006 to 2012, talking about the number of pills, opioids sold in the U.S. by county, by pharmacy. A lot of data has come out through this database, and one of the things that was revealed was that, and also in combination with other things, this was Zach Matson's article, was that Montgomery County basically had 50% higher than the state average in terms of the volume of pills being sold, like per person, and in that category. You had 800 prescriptions per 1,000 people, which is an unbelievable number of prescriptions. And we were talking during the break a little bit. Montgomery County has joined in this lawsuit that's including many other municipalities, including Fulton County and the city of Amsterdam, that is going after the manufacturers and the distributors of opioids. And this is all the legal aspect of this of the market. Okay, there's also the illegal stuff. There's heroin and that kind of thing. But that's sort of the next step. This is they're going after the companies that have done this. And part of this is the market, the aggressive marketing and all, and what went on. Sarah, can you speak to some of that?
So sure, I can just tell you from my own personal experience, not with the county, but coming from a healthcare field, there are pharmaceutical companies that market and sell pills for everything: asthma, diabetes, erectile dysfunction, smoking cessation. You can't. At one point, you couldn't go to a hospital or a doctor's office without pharmaceutical reps coming in and trying to sell and push the pill of the day that people allegedly needed. So when we look at the opiates, it's really no different. You used to go to the hospitals and there would be pharmaceutical luncheons, and they'd bring in these humongous, famous catered lunches, and they'd give out pens and take doctors out to dinner in order to try and get them to prescribe their pill. So it's not just opiates. We really need to take a look at the pharmaceutical industry as a whole, not just from opiates. You see commercials on TV for different pills every single day, the new thing. And while medications are wonderful and we need medications for a number of illnesses and diseases, I think we need to remember that the pharmaceutical companies push medications, not just opiates.
That's correct. And we were also talking during the break that there's many legitimate purposes for these drugs, as long as you don't abuse them. But the abuse is where it becomes an issue. When you have 800 prescriptions per 1,000 people, it defies credulity that there weren't a significant number of prescriptions that were not right in that. I mean, perhaps fraud, perhaps doctor shopping, and doctors wouldn't necessarily know that if one doctor gave you an opioid prescription, the next doctor wouldn't even know that had happened, and some people do that, right?
Correct. I mean,
Yep.
and there is an addictive piece of this. If somebody goes to a CVS pharmacy and gets a prescription, and then they went to the Rite Aid pharmacy and filled another prescription, what the state has done now is we have a database. I believe it's called the Start or the Stop. I can't remember if it's Start or Stop, but it is a database that pharmacies are using that can go in and sort of track you by your person to know where you are getting medications. It also falls onto the doctors, physicians. Physicians are very busy, and I have a lot of friends who are physicians in different areas, and PAs and NPs, and it's becoming more and more difficult to manage everything that patients are coming in with. So when you add addiction on top of that, and you add pain management on top of that, it becomes very difficult. So when I look at why we have such a high number here, and what are some of the contributing factors, I think it's not a one-size-fits-all. I tell people all the time, Montgomery County is very unique in that we have 3 thruway stops, and at each thruway stop there is almost like a landmark. When you get off the thruway in Amsterdam, there's signs for the hospital. And I know from my work in healthcare that working in a hospital in healthcare, people are transient to this community. People come from Buffalo, they see the sign for a hospital, they get off, they go to the emergency room, they get back in their car, and they drive to wherever they're going. They come up from New York City, same thing. They see a thruway sign that says hospital this way. And so we are in the middle of the state. We have, again, 3 thruway stops with 2 truck stops and a hospital right off of our exits. So I think we are unique for a lot of reasons. And unfortunately, the fact that we have access to healthcare right off the New York State Thruway is a detriment as well as a strength that we have in the county.
Yeah.
We also have, one healthcare facility. We have 1 hospital, 1 emergency room. So, people from all over come here. It's not just our county residents. And that is one thing, when I look at these numbers, I wonder how many of these prescriptions that were written and filled in Montgomery County were for people that didn't even live here.
Yeah. One of the things I noticed in the pharmacies was that number 5 for Montgomery County was actually, it was in St. Johnsville. And it was over 1 million pills. I mean, when you see Amsterdam's, is a city, okay,
Yep.
of people, okay, many more people than live in St. Johnsville, okay? I mean, so when I see that at number 5, I'm like, that's red flag. Something's not right there.
Right. But it's the westernmost part of our county,
Right.
It borders other counties. It has healthcare facilities, and for some people, it's the closest. St. Johnsville's a city for some folks,
Right.
who live in the rural area, and there is a pharmacy there. There are stores there. So, again, I wonder how many people from surrounding counties utilize the pharmacy services in St. Johnsville. During our break, I was talking to you guys. I grew up in Galway, which is Saratoga County, but I never used a provider in my own county because Amsterdam was closer for us. I was
Right.
born at St. Mary's. All of my doctors were through St. Mary's because it was closer than going to Saratoga Hospital
Right.
or someplace in my own county.
Yeah.
So again, I wonder when we look at these numbers, how many of these prescriptions are for folks who are actually Montgomery County based residents?
Right, and a good chunk of them maybe somebody. I've got a prescription in Amsterdam. I got another one in St. Johnsville.
Correct.
I got multiple places I'm going to go, and I'm going to have 2 or 3 or 4. Because when you have 800 per 1,000 people, I mean, there's got to be people in there with multiple. And I would also think, and I don't know this, but I would assume that some of it has to do with drug dealing. I mean, I don't know that, but to me, it looks obvious that must be part of it.
Absolutely, Jason. And I think, when we're talking about the legal uses of medications, that is one aspect. But I think what we are forgetting here is that a lot of what people are being arrested for and charged for is the illegal use of medications. Right. You can get arrested for having a prescription for anything that doesn't belong to you. Right. If I have a prescription for a diabetes medication and I get pulled over, the police officers are going to question me. Why do you have a prescription for metformin that has Jason Subik's name on it? What are you doing with Jason Subik's medication? Right. The illegal drug use, and it's not just opiates, it's not just pain pills, it's not just stimulants or benzos, it's illegal drug use as a whole.
Yeah. And you had talked to the sheriff before you came on, and he had a little bit of information for you, correct?
I did. Hi, Sheriff Smith. So one of the things that Sheriff Smith and I talked about this morning was when we're looking at our public education and when we're looking at what we are doing in order to educate our communities on drug use, illegal drug use, we are really working together. I mean, the sheriff and I have conversations probably 2 to 3 times a day, for hours at a time sometimes about these issues. And we now have a drop box in the sheriff's department where people can go and drop off unused prescriptions. Instead of just leaving them in your medicine cabinet or throwing them in the garbage, you can take them to the sheriff's department and dispose of them in a safe, legal manner. He has now allowed peer services into the jail where folks who are in recovery or in treatment can work with folks who have been arrested for drugs or substance abuse to help get them connected to treatment and programs that will assist them to get off of any substance. And one of the other things that we really talked about was there is a difference between opiates and heroin. And I think people are confusing and using those things simultaneously, and they're very different.
There's now I remember writing this article because Montgomery County is one of the it's not the first, but it's among the first to get in that circuit of courts that it belongs to, the opioid court,
yes.
Which is going to be people who are in crisis who will be able to get into a rehabilitative situation, fast-tracked, essentially. We talked about this the last time I think you were on.
Yep.
And one of the things I learned writing that article was that there is the concept of the opioid, which I believe is the synthetic, right? Or then there's the opiate, which is I don't know, but there's different types of it. Okay.
Correct.
And heroin is an opiate. Okay, but it's like it's the worst, right? And,
Well, right. It's a manufactured illegal illicit drug,
right.
where an opiate is a pill. It's your hydrocodones. It's your it's your actual prescription medications,
right.
And it is legal if you have a prescription. Heroin, and in no way, shape, or form, is legal. And I think the sheriff would agree with me.
Yeah. Let's take our last commercial break, and we're going to come back with Sara Boerenko from Montgomery County talking about this important issue. And we're back. It's the Mid-Morning Show. I'm your host, Jason Subik. The phone number is 518-843-2500. And this is WCSS 1490 AM radio, 106.9 FM. We've got a call coming through. Let's take this call. Good morning. You're on the air.
Yeah, I have another question for Sara. I read an article in the paper a couple of weeks ago about a presentation that you and I believe his name is Joe Gambino from Community Healthcare made at the Fonda Fultonville School.
Yes.
In terms of, looking into the possibilities of having a provider right at the school, a physician, to provide services for students, not only a school doctor, but also for kids who just get sick in school or, need to see a doctor. I was curious as to why Fonda Fultonville was number one targeted. I know the program is working very well at Schenectady schools, but to me it seems that the demographics of the students at Fonda Fultonville are a little bit different. Is it a case where students just aren't receiving adequate health care? What's up with that, really?
Well, I think there's a few things that came about. The first thing that came about was when we look at our school districts. Tom Ciaccio, the superintendent of Fonda, and I work very well together, and he is one of the long-standing superintendents in the district. Currently when we look at the other school districts, I know unfortunately we just lost Deb Grimshaw up at Canajoharie. She retired. Dave Ziskin from Fort Plain, he's taken another job within the BOCES system. St. Johnsville has a temporary superintendent, and Amsterdam has a temporary superintendent to date that I'm aware of. So I think Tom Ciaccio, when him and I talk about things that the community needs, we talked about school-based health services in a different manner. So it's not that the students at Fonda aren't getting medical care, it's that the students there, because it is so important for them to maintain academic standards, and the school is very big on holistic and making sure that students have the availability of services, we thought it might be a good pilot program, and we're a rural community. So the school district and Mr. Ciaccio and I talked about how if we had a physician or a PA or an NP on site providing school-based health services, then kids would not have to leave school to go get a physical. Kids would not have to leave an academic day in order to go get the vaccines that they need. Or if a child had a headache or a sore throat, they didn't have to necessarily miss an entire day of school in order to go visit a physician. We know that it is very costly for parents to take their child out of school for a half a day or a whole day and spend it at a doctor's office. Whereas if the child can access services right there, they can go visit the school-based clinic that is run by the Hometown Health Corporation, not by the school district. They can go visit that physician, get what they need, and then return to class without having to miss an entire day of their academic studies.
Yeah, I understand. I think Middleburg also, or maybe Cobblestone, one of those.
Yep, Middleburg.
Has Middleburg, and it's working well down there?
It is. It's working very well, and it's working well in a big school like Schenectady, too. You know, Middleburg is comparable to the school districts that we have here in Montgomery County, and I think, you know, one of the things that Jason and I often talk about here on the show is that Montgomery County is very rural, and so if you can't get people to go to where they need to go for services, no matter what it is, medical, health, or other services, it's always a good idea to bring it to them.
Yeah. You know, another question, why community health center, and why not put an RFP out to different providers in the area, like the hospitals, you know, St. Mary's or Nathan Latour, you know, to see who also would be interested in providing that service to schools?
Sure, and that's a great question. And we may, the interview and the meeting that we had at Fonda was to bring information. It was not to say, yes, we're definitely going to use this agency or another. It was an informational session where we brought a provider in who is already doing it to tell the board and the community how it works, and if they're interested, they may have to RFP depending on what the board decides. But it just so happened that Hometown Health Center already does school-based health, and you know, for the hospital, I don't know if they have any interest in doing school-based health. It's a huge undertaking, and it's not, as Mr. Gambino said, it's not a moneymaker. You know, Hometown Health loses money on their school-based health centers, but they don't do it for the money. They do it because it's what's best for the community. So the article, I think it didn't really portray enough that it was really just an informational session. It wasn't that the school is definitely going to do this, we're definitely going to go with Hometown Health. It was, this is what we do, and if you want it here, let's talk about it.
Okay, caller, thank you. Appreciate the call. All right, so in the last few minutes here, we do want to talk about what comes next. So,
sure,
yeah.
Absolutely. So, you know, one of the things that Zach talked about so well in the article is about what we are doing. And I think, Jason, you and your callers know me well enough that I don't just sit around and talk about things. We actually are doing things. And one of the things that we are doing is we have started an overdose task force. A lot of counties are looking at an opiate task force, but as I have said over and over again, at some point opiates are going to be gone, and we're going to be looking at the next thing. And when I work with our treatment providers, when I work with St. Mary's Healthcare and the folks at St. Mary's, Vic Giulianelli and his staff, or Rachel Trunkenmiller from HFM Prevention, Catholic Charities and their staff, we are really going to to look at this epidemic and look at what is next, and staying ahead of the game. And it's not just opiates and heroin that folks are overdosing from. You know, when I look at death certificates, or I look at what folks are overdosing from and dying from in our county, it is not necessarily just the opiates and the heroin. We know benzodiazepines and alcohol are on the rise, and those two things do not go together. You can't take a tranquilizer and drink alcohol. You know, that's a deadly combination. It's lethal. So when we're looking at the overdose task force, one of the things that we are doing is we are working together to get a resource guide for folks that are struggling and they may not know all of the new resources. So that is one thing. I'm working with Tommy Pasquarelli and the folks over at GAVAC to get Narcan kits together that his folks on the ambulance can use to give to people. So if they are in need of treatment, whether it's opiate, benzos, alcohol, they can give people information right then and there on the spot. We are working on getting a group of folks together for August 30th to go down to the Capitol to talk about International Overdose Day. International Overdose Day is August 31st, but on Friday the 30th, we are going to stuff a bus full of folks to go down to the Capitol to, really get awareness and the message out about overdoses. We're working with parents who have lost children to overdose. We're working in conjunction with suicide prevention, because we know that folks who complete suicide, that about 90% of folks who complete suicide have some type of substance in their system, whether it's alcohol or a benzo or an opiate or heroin, and a legal or an illegal drug. We know all of these things. So we're taking everything that we know and we're going to start doing very concrete tasks. And our first concrete task, again, is making sure that our EMS, our law enforcement providers, are trained, that they all have a Narcan kit, or that they have a resource guide that they can give to a patient that they come in contact with that said, here are the tools, here are the resources, call this phone number, call this person. Chief Kulik from APD has been amazing in letting us work with some of his officers and giving them palm cards to give to folks that they are coming across. Sheriff Smith, again, wonderful. So we are doing those things that we said that we were going to do. We also have trained 7 physicians in Montgomery County to be buprenorphine waiver providers, which means that they now have the capacity to prescribe buprenorphine, which is Suboxone, to patients who are trying to come off of illegal drugs and detox themselves in a safe and healthy, effective manner. So in tiny little Montgomery County, we now have 7 new providers. That's amazing. That is a huge task. Nobody thought we would be able to do it. Well, we did it. I got it done. Dr. Cope was so amazing and wonderful in helping us train those new physicians so that they have that tool in their toolbox. And I could keep going and going and going, but those are the concrete things that we are doing here to really combat this overdose crisis.
Sara, I really appreciate you coming in. Obviously, a very tough subject, but it's good to know that action is being taken, and we're going to continue to follow this. But I really thank you for coming in.
Jason, thank you as always.
All right, I want to thank everybody for listening to the show. You've been listening to WCSS 1490 AM radio, 106.9 FM. We're going to head straight into the news. We'll be back again tomorrow. Thanks a lot.